5 early signs of kidney damage you must not ignore. Kidney damage is a silent process. Did you know that more than 1 in 7 American adults have chronic kidney disease? Yet 9 out of 10 individuals with chronic kidney disease, or CKD for short, are unaware of it. Kidneys can gradually and silently stop working over 10 to 20 years before reaching end-stage kidney disease, or ESKD for short, when your kidneys lose 85 to 90% of their function. Catching kidney disease early is your best chance to deal with it. CKD usually shows no symptoms during the early stages. However, an early diagnosis is made based on abnormal lab tests. We will get into those tests shortly, but right now, let's first discuss the early signs and symptoms of kidney disease that you can easily notice at home or detect with the naked eye. Before we dive in, please note, all the information in this video is created by real people, thoroughly fact-checked, unbiased, and reviewed by qualified professionals. 5. Foamy urine. Foamy urine is when there are persistent layers of small to medium-sized bubbles in the urine seen in the toilet. Consider a single layer of large bubbles that quickly dissolve as a normal finding. It can be due to either the force of the urine flow or other normally found substances within the urine. The reason for foamy urine in chronic kidney disease is proteinuria, the presence of proteins in the urine. Proteins like albumin are typically found in the bloodstream and are not supposed to be in the urine, but they can leak out if your kidneys are damaged. Albuminuria is among the earliest signs of kidney disease and can even be seen in stage 1 CKD. However, only about 1/3 of people reporting foamy urine are found to have abnormal proteinuria. 4. Nocturia. Nocturia, which is the term for getting up to pee at night, occurs with polyuria, that is, the production of excess urine that can happen with CKD. Polyuria may be nocturnal only or occur over 24 hours. The disruption of salt and water balance with CKD can lead to either nocturnal or 24-hour polyuria. Age-related changes in circadian rhythms, which are the body's sleep-wake cycle, can also contribute to nocturia. Other causes for waking up at night to pee include diabetes, obstruction by the prostate gland, pregnancy, urinary tract infections, and more. Nocturia can be an early symptom in CKD. Research suggests that declining kidney function is associated with nocturia and correlates with increasing frequency of nocturia episodes. Kidney function is measured by how quickly your kidneys filter waste, called the estimated glomerular filtration rate, or eGFR for short. In a 2023 survey study, eGFR was slightly decreased in people with nocturia compared to those without. Are you enjoying our video so far? If so, please give us some hints by dropping a like and we'll make more content like this. 3. Blood in the urine. Hematuria is another term for the presence of blood in the urine. The blood may be grossly visible, known as gross hematuria, or not visible to the naked eye, which is called microscopic hematuria. Early CKD may present with either of these. If you notice urine that is overtly bloody, red or pink, brown or tea-colored, this could be due to bleeding. Unlike gross hematuria, microscopic hematuria is not visible as a color change and is thus typically detected by a routine or incidental urinalysis. Urine dipstick and microscopic testing can help confirm your suspicion of blood in the urine. A 2018 study revealed that the presence of microscopic hematuria in patients with moderate CKD indicated an increased risk of disease progression and death during the first 2 years of testing. Participants were diagnosed with hematuria based on a positive urine dipstick test. The study also revealed that the prevalence of hematuria increased with falling eGFR levels. 2. Decreased urination. Chronic kidney disease may also be associated with decreased urine production or oliguria. Although CKD itself rarely results in low urine production. Acute kidney injury in someone who already has underlying CKD is the usual mechanism. For example, this can occur if you have a chronic urine outflow obstruction contributing to CKD, and then develop urinary retention with low to absent urination. Other causes include severe dehydration, shock, or another reason for reduced blood supply to the kidneys. 1. Flank pain. Flank pain is the pain felt on the side of the abdomen, between the ribs and the hips. Pain occurs much more commonly in people with CKD compared to the general population, either due to the direct involvement of the kidneys or with associated comorbidities. Chronic flank pain is the most common symptom of polycystic kidney disease. Other diseases of the kidneys that increase your risk of CKD and may present with chronic flank pain include kidney infection, inflammation, tumors, narrowing of the vessels supplying the kidney, and other abnormalities of the kidney vasculature. Beyond the kidney, obstruction of the urine outflow pathway, such as with stones or obstruction by birth, also predisposes you to develop CKD and present with flank pain. Now, if you have the symptoms we talked about, what can you do to protect your kidneys and stop the disease from getting worse, especially? How can I know I am at risk? The risk of developing CKD increases if you have hypertension, diabetes, cardiovascular disease, heart failure, or a history of AKI. Among these, hypertension and diabetes are the two most common causes of CKD in U.S. adults. An estimated 1 in 5 people with hypertension and 1 in 3 with diabetes go on to develop the condition. Living in a region with a high prevalence of CKD also increases your risk, as do environmental exposures. The risk is also higher in those who have other medical conditions, such as recurrent kidney stones, abnormalities in the urine outflow tract, HIV, lupus, vasculitis, medications, radiation therapy, or a family history of kidney disease. The hallmark of CKD is reduced kidney function for at least 3 months. As the kidneys gradually lose functioning tissue, there is a progressive decline over a period of years. Doctors categorize this decline into CKD stages 1 through 5 based on your eGFR. Complications of CKD include a buildup of fluid and toxins within the body, high blood pressure, electrolyte abnormalities, anemia, heart disease, and weak bones secondary to low calcium and vitamin D levels. The onset of these complications accounts for the symptoms seen in more advanced stages of CKD, like fatigue, poor appetite, a metallic taste, nausea, vomiting, weight loss, swelling around the eyes, legs, and feet, shortness of breath, or confusion. Which test can help you detect kidney disease early? In a recent study, an evaluation of individuals meeting lab criteria for stage 3 CKD showed that getting an earlier diagnosis delayed further decline in kidney function. This was proven by lab values taken 2 years before and after CKD diagnosis. Diagnostic delays in diagnosis at a late stage of CKD were associated with an increased risk of complications, further highlighting the importance of early diagnosis and management of the disease. Screening plays a crucial role in the timely detection of kidney disease, as early stages do not usually cause symptoms. Get blood and urine screening annually if you have any of the previously mentioned risk factors, most importantly, hypertension, diabetes, or heart disease. Screening for CKD in individuals with type 1 diabetes should start 5 years after their diabetes diagnosis, and with type 2 diabetes, it should begin at the time of diagnosis. 1. Blood test. Blood tests include measuring a serum creatinine level. Creatinine is a waste product produced during normal metabolic processes. Getting a serum creatinine level allows for the calculation of your kidney's estimated glomerular filtration rate. As your eGFR goes down, your creatinine levels rise, showing that your kidneys are not filtering waste products properly. Blood urea nitrogen, or BUN for short, is another blood test that measures your kidney's ability to filter waste products. However, the serum creatinine level is a much more reliable indicator of kidney function, as it is less likely to be affected by other disease states or dietary changes. For example, malnutrition and starvation decrease BUN levels, whereas dehydration and high protein intake increase them. Fever, burns, heart failure, bleeding within the GI tract, and urinary outflow obstruction also tend to increase the BUN. Serum creatinine levels remain unaffected in each of these conditions. 2. Urine test. Urine tests to screen for CKD include checking for the presence of proteins, specifically albumin. Damage to your kidneys can cause albumin, typically found within the blood, to be lost in the urine. Determining the urinary albumin to creatinine ratio, abbreviated UACR or ACR, helps estimate the amount of protein lost. Evidence of kidney damage includes having protein or blood in the urine, an abnormal urine microscopic exam, CKD-relevant findings on kidney imaging or biopsy, electrolyte abnormalities, and a history of kidney transplant. For those interested in the evidence, the studies supporting our claims are provided in the link in our description box. What treatment options are available for kidney disease? There is no cure for CKD as it is irreversible. Thus, the aim of treatment is to stop the disease from getting worse and to improve your quality of life. Doctors may prescribe medication, advise other treatment methods, or give guidance for lifestyle changes to slow disease progression and manage any complications. 1. Medication. Medication may include drugs to control blood pressure, blood sugar, or lipid levels. The KDIGO 2024 guidelines recommend keeping your blood pressure's top number, or systolic, below 120 millimeters of mercury. For blood sugar, the KDIGO 2022 guidelines recommend keeping HbA1c below 6.5% for those in stage 1 CKD and below 8.0% in stage 5. If your levels are outside these ranges, your doctor will prescribe medications as needed. But note that with CKD, you also have to be careful with the medications you might be taking, as multiple drugs can further damage your kidneys. Some of the commonly used drugs that might negatively affect the kidneys include the non-steroidal anti-inflammatories, such as ibuprofen, or proton pump inhibitors like omeprazole or esomeprazole. 2. Lifestyle changes. Lifestyle recommendations include engaging in regular physical activity, consuming a healthy diet, and quitting smoking. Adequate exercise includes moderate intensity physical activity for at least 150 minutes a week. A healthy diet means consuming more plant-based foods and less ultra-processed foods. Aim to achieve and maintain a healthy weight with diet and exercise. You must also avoid the use of tobacco products to reduce your risk of heart and lung disease as well as cancer. On our channel, we've shared many videos about simple lifestyle and dietary changes to help manage kidney disease. Check them out and you'll find what foods to avoid, what to include more of, and see how small changes can make a big impact. Don't miss out on all the helpful advice. 3. Renal replacement therapy. The decision to move toward renal replacement therapy, as in dialysis or kidney transplantation, will be made jointly by you and your doctor. With no absolute cutoff defined, several factors contribute. Typically, however, it is reserved for stage 5 CKD, also known as end-stage kidney disease or kidney failure. The KDIGO 2024 guidelines recommend planning and preparation for renal replacement therapy when the eGFR falls below 15 to 20 milliliters per minute per 1.73 meters squared. Dialysis is an effective means for maintaining kidney function. Hemodialysis and peritoneal dialysis are the two forms of dialysis available. Hemodialysis is done using a machine called a dialyzer that filters the blood. Blood from a specific vascular access point circulates through the machine's tubing, filters across the designated membranes, and then returns to the body. Each session lasts around 4 hours, and it is typically performed 3 times a week, though it might be more or less depending on the patient's need. Peritoneal dialysis uses the lining found naturally around your abdominal organs, known as the peritoneum, as a filter. First, a catheter is surgically inserted into the abdomen. Then, with each session, dialysis solution enters through the catheter, remains outside the peritoneum, pulls waste products from the blood, and later exits through the same catheter from which it entered. Treatment for CKD is costly. Annual spending by Medicare in 2020 for people with CKD aged 66 years and older was $75 billion. And for end-stage kidney disease, $50.8 billion. Cost analysis highlights the financial burden tied to CKD, apart from the debilitating nature of this chronic disease for individual patients. While we have addressed the financial and physical burdens of chronic kidney disease, it is crucial to include in our discussion the importance of taking preventive measures to reduce the risk of kidney disease and dialysis. How do you prevent kidney disease and dialysis? A healthy lifestyle is the most cost-effective and safest way to prevent and manage chronic disease. It includes maintaining a good diet, regular physical activity, smoking cessation, weight management, and minimizing alcohol intake. Combine that with the regular periodic follow-ups your doctor recommends for monitoring your kidney function. Conclusion. To summarize, chronic kidney disease is diagnosed when there has been abnormal kidney function lasting 3 months or more. Early signs of CKD include foamy urine, blood in your urine, needing to urinate at night, urinating less, and pain in your flank. CKD poses a global health burden with its associated risk of cardiovascular complications and even death. The majority of people with CKD are asymptomatic and get diagnosed late in its course, increasing the risk of disease progression and its complications. Keep an eye out for underlying risk factors like hypertension or diabetes that make you more prone to developing CKD. Be knowledgeable about the associated symptoms of early disease and what steps to take. These and other preventive measures can help limit harm. Opting for a healthy lifestyle and regular screenings are key takeaways for reducing your risk of developing CKD or progression of CKD to the point of kidney failure requiring dialysis. Now, we want to send a big thank you to all our current subscribers and viewers. Your support inspires us to continue sharing valuable content. Hit the bell icon and turn on all notifications so you never miss a life-saving video. If you feel like your kidneys need some extra care due to unhealthy foods and lifestyle choices, check out the video on the screen. Here, we share the top 5 fruits that can help cleanse your kidneys and offer tips to get the most from them. See you there. Stay informed, stay healthy,